Healthcare, because the House is going to vote on a new bill this afternoon. I want to bring in Congressman Chris Collins, a Republican from New York. Congressman, is this going to make it through?
Yeah, Charles, this has been a tough journey, but about 1:15 today, we will get this passed. And as we're seeing Obamacare fail hour by hour, day by day, this couldn't come soon enough, and we're going to pass this over to the Senate. They're going to have to do their job so we can get it signed into law. But the first step is getting it through the House. We're going to do that today and then pass it on to Mitch McConnell and our 52 senators.
Of course, you understand that there's a tremendous amount of pushback and criticism over this. There's no CBO score. It's been patched together fairly quickly. It's doubtful anyone knows everything that's in this thing. So we got a little bit of a Nancy Pelosi thing going on here. And there are legitimate questions. Does this keep Trump's promises that no one will lose coverage, that premiums will go down, and that there will be no Medicare changes, and Medicaid changes, rather? And it feels like a lot of semantics, but no clear answers.
Well, Charles, first of all, it's going to reduce premiums. The CBO score was 10%. We have a score on the base bill, and while there were a couple of minor tweaks here at the end, there's not going to be any significant change in the CBO score of dollars and cents. We're saving tens of billions of dollars. We've already got the score. It's going to reduce premiums 10%. And the main thing, Charles, is the exchanges are failing. We just found out today 94 out of 99 counties in Iowa are not going to have insurance next year. Aetna's pulling out, other increases in the 58% range. So for the next 2 years, 2018 and 19, we're going to still continue to feel the pain of Obamacare.
You're not concerned that you're opening a Pandora's box in the future when a Democratic administration takes over and they could exploit some of these things that are going on? Like, for instance, the Upton Amendment, the $8 billion for 5 years. Many are saying that's a fig leaf. Now, if Democrats get in, what's to stop them from making that $80 billion? It feels like perhaps it's a victory today, but you could be establishing a bigger loss down the road.
No, I don't agree. First of all, I don't see the Democrats getting control of Congress or the White House, certainly not in the next 8 years. But putting that aside, we have to do what's right today, and Obamacare has failed. So what we're doing is shoring up the exchanges down the road, and it's 7% of Americans. Let's remember, 93% of Americans are getting their health insurance through their employers, TRICARE, Medicare, and Medicaid. It's a very small number of people, and not to discount how that would affect them. Obamacare has already failed. It's not failing. It has failed, and every day the news is worse. And for the Democrats to suggest otherwise is disingenuous and not truthful.
Congressman Collins, it's always a pleasure having you on. Thank you very much.
Good to be with you, Charles.